Hello, I'm Janice Karen, Director of Policy, Technology, and Innovation at the Massachusetts Health Data Consortium, or MHDC. I run our Data Governance Collaborative, also known as the DGC. We start each of our weekly meetings with a series of industry quick updates to learn about new and proposed regulations, laws, standards, industry initiatives, and other activity. Join us for this week's updates. If we'll go to the first update, please. So the first update, CMS has put out some small updates to its strategic plan, and the link goes to the full plan, but they highlighted in an email some of what they updated. The big things that they updated were that they've started a new oral health initiative where they're trying to expand access to oral health coverage. So it's not clear exactly what they're doing in that area, but they are looking to do some work in that area moving forward. They have added some of the stuff they've been doing recently to their health equity fact sheet. And they also are looking at how to better align the different CMS programs and have better continuity of care when patients move between Medicare, Medicaid, and marketplace plans. They call it the 3 M's. And basically they're trying to get a better process in place and have a better patient experience when that happens. So you can find the full plan there. The plan doesn't actually call out what's different. This came in an email that said, hey, we've updated this, here's what we've updated. So there's a lot of stuff there though that's kind of interesting if you wanted to look through it. Any questions or comments there? All right, let's move on to the next update. So starting the security section of the proceedings, HHS has put out a healthcare security sector security alert. There are two ransomware as a service groups that are fairly well known that have been exploiting 3 new vulnerabilities that have been found in a popular Microsoft print management service called Papercut. This service is, as you can see on the slide, is used by more than 100 million users in 70,000 companies. It tends to be larger companies, as you can tell. But it's a really bad vulnerability because it allows actors to completely bypass authentication and act as a system user. So the reporting that they gave about kind of the details about the use of this software with the vulnerability, they didn't specifically report on the healthcare sector itself. But basically, if you're using this software, you should either cease using it or do updates immediately and be aware that this vulnerability is pretty darn bad. You can find a link to it there. It actually came out, it's not brand new. It came out like, I want to say a week and a half ago. But it just came to my attention and it really, I literally can't remember the last time I saw something that not only completely bypassed authentication processes, but also allowed someone to be a system user, because that basically lets you do anything. It's like being a root user on Unix. So any questions or comments there? All right, next. So the Health Sector Coordinating Council, which is HSCC for short, put out a report at the end of April outlining, excuse me, recommendations for how the government can support improved cybersecurity within healthcare. So this was an interesting report because it wasn't just it wasn't aimed at the people in the healthcare organizations trying to do security work. It was actually aimed at other government agencies to talk about how they can structure oversight, regulation programs, et cetera, to foster better cybersecurity practices. And so it talks about some recent programs and how they work. It talks about some foundational policy thoughts. It talks about the ways that different groups and agencies can work together. It has some actual concrete suggestions, and it covers 5 different categories: preparedness, support, information sharing, financial support and incentives, incident response, recovery, workforce, and policy foundation. That policy foundation current developments is kind of what I was just talking about, where they go into what people are actually doing now and trying out and how that's going. So it's a really interesting report. I still have more to absorb in it, but it's, again, because it's from a different perspective, it gives some idea of some of what might be coming from a regulatory standpoint, or just also what might be coming in terms of availability of funding to improve your cybersecurity, things like that. So I definitely recommend this one, and you can find the link there. Any questions or comments there? All right, next. So also, again, on the cybersecurity front, the HHS has released a hospital resiliency analysis report, and it basically was looked at the current cybersecurity preparedness at US hospitals and wanted to again, there's some component of it that was what the government can do to improve cybersecurity resiliency, but also aimed at the hospitals themselves for things that can happen. So it looked at 3 types of data: the threat data from different areas. There were some surveys that were done by CHIME and by the American Hospital Association in class. And so they looked at data from those, and then they talked to 20 different hospitals about their programs, what they've run into, et cetera, from different portions of the country with different demographic bases. So what they found, obviously they found other things, but some of the key findings were that some of these are not going to be surprising, that directly targeted ransomware is growing, and it's an outsized threat compared to some of the others. That means that it's riskier and more problematic when it happens. That there are some hospitals that are doing things really well, and other hospitals that are missing even some of the basics, and they call out things like some simple things like having multi-factor authentication on things, but there's a bunch of specific practices that they call out around having variable adoption from hospital to hospital. But they do say that in general, email systems are protected fairly well. And they also say one of the things that has been called out in the past as a big fear, and also it's also one of the things that's probably an outsized risk in terms of if it happens, the consequences are fairly dire, but they have not generally found that medical devices have been exploited. But so that obviously can change at any point, but at the time and with the data available to this analysis, that has not yet been the case. And again, they found, just as they found variable adoption of different security measures, they found that there was a large variance in how well hospitals were able to rebound from security incidents, and potentially how well they could if they happen. So you can find the full report at that link. It's pretty interesting. Again, covers some of the same stuff, but in a slightly different way. So I think it's kind of interesting the way that people are looking at things from slightly different angles. Any questions or comments there? All right, next slide. All right, so this one was really interesting. It's the same organization that did the last report, and they apparently put out an annual health industry cybersecurity practices document. And it looks at this particular version at least, looks at cybersecurity as a threat to patient safety. But this was interesting because it was it was obviously aimed at a much broader audience than a lot of the security documents. It has a much friendlier tone. It has, graphics. It's got a lot of background information. It's just a super easy, it's almost a fun read. I mean, it's actually interesting. And almost like I opened it up and it almost made me smile because it was just enjoyable, which is kind of a weird thing to say about a document that's talking about security. But it talks a lot about voluntary consensus-based industry-led guidelines. It's set out to meet 3 goals: to cost effectively reduce cyber risks in healthcare, to support voluntary adoption of the recommendations, and to provide actionable, practical, and relevant content. And it organized the content and recommendations into different categories that were easy to understand, but it also then organizes things by organization type and size. So you can also go to sections that talk specifically to your organization. And I just thought it was a really this one definitely doesn't have anything like shockingly surprising in it, but it was just so well put together and well thought out and well organized. And it just presents the information in a way that I feel like it's likely to get a larger group of people to listen than some of the other documents, which are, let's face it, kind of more dry academic documents. So I mean, I could be wrong about that, but it was just so refreshing after all of the other documents. So any comments or questions there? All right. If anyone reads it, you can tell me if I'm off my rocker. Let's move on. All right, so I know that we had sort of a general look at the end of the telehealth. I'm sorry, what happens at the end of the pandemic, each of the last 2 weeks, but HHS put out a specific fact sheet on the telehealth flexibilities, and particularly as there was some question a couple weeks ago on exactly how one of them was applied. I thought it worth taking another look because what it does a few things. It kind of puts everything in one place, specific to telehealth. And one of the things that it does is it actually specifically points out that there were some of the telehealth flexibilities that were put in for the pandemic were actually put into law to be effective through 2024 in last year's Consolidated Appropriations Act, basically the budget bill. So this maintained access to telehealth in any geographic area. The ability this is for CMS programs, the ability to participate in telehealth from home instead of traveling to a healthcare facility, and continuing to support audio-only telehealth for some services. And the way that it was written was for services where it was deemed effective and appropriate. So there obviously are some services where audio only is not viable when someone needs to look at something. So I thought that so those pieces are actually in law through the end of 2024. They also talk about how the ACOs and Medicare Advantage plans and all of the CMS run programs that are being fulfilled by other organizations have the option to continue to support the services after that date, regardless of what the law says. They also point out that the Medicaid, CHIP, and private payer telehealth support will vary by plan, and you have to check with your own payer. The HIPAA enforcement discretion will expire on August 9th. That's the 90-day extension that came up in one of our previous update slides. So that was explicitly pointed out here. Also, in-person requirements for opioid treatment prescriptions and plans will resume a year after the end of the public health emergency, so next May. And this one has been in the news a bit, so you may have heard, but controlled substances prescribing flexibilities have been extended through November 11th, 2023, pending additional rulemaking. Originally, those were supposed to expire sooner, but there was a big hubbub. Actually, each of the last two had a big hue and cry around the having them end sooner. And so what they're planning to do is some additional rulemaking, and this extension is to give time for that. So you can find there's several other items that are called out. This isn't 100% of them, but these were sort of the major highlights. So you can find the full list and the full fact sheet there, but I thought it was sort of a nice single go-to for telehealth flexibilities. Any questions or comments there? All right, next slide. If you'll pause there for a moment. I hope you learned a lot from our quick updates. If you're interested in finding out more about the DGC and its other activities, email me at dgc@myhealthdata.org. That email address is also on your screen.